The following information is intended for educational purposes only. It is not medical advice. The views expressed do not reflect those of this broadcaster. Should you choose to implement this information, please do so only with the assistance of a licensed medical professional. Neither the presenter nor this broadcaster assume any responsibility for any adverse effects or consequences that may result.
We've always been told that there's nothing we can do when viruses come along, that we just need to go see our doctor and go to the hospital. But are there things that we can do on our own, things we can do before we get sick to ensure that maybe we don't get sick? Well, our guest today is Dr. David Brownstein, and he's written a book called A Holistic Approach to Viruses, and he's about to give you a health awakening. Are there different approaches to taking care of your health rather than just taking a medicine or doing something else that you may not want to do? Is there more holistic approaches to avoiding viruses and healing yourself? Well, one person who knows about that more than any that I know is Dr. David Brownstein. Dr. Brownstein, thank you for joining us today.
Thanks for having me, Scott.
So on the Health Awakening, we like to give alternative ideas for folks if they want to do something other than mainstream medicine. And I know that one thing that we've talked about in our home is nebulized hydrogen peroxide. And this has sort of come on the scene recently, at least for some of us, that it's an alternative treatment for things that are floating around in the air these days. So could you explain to us, why would someone want to nebulize hydrogen peroxide, and maybe just go with, what is nebulizing in the first place?
Well, Scott, nebulizing, it basically means to put something into a mist. So nebulizing has been used in conventional medicine for decades. And I grew up as a child with asthma, and I remember going to the emergency room a few times for an asthma attack, and they would have me nebulize medications such as albuterol to open up my lungs, when I'm having an asthma attack. And that stuff is still used today. Asthmatics will nebulize medication to open up their lungs. Chronic obstructive pulmonary disease, COPD, from smoking years and years of cigarettes. They have difficulty breathing. They'll nebulize to help open up their lungs and oxygenate. So medicine has used nebulizers for decades to get different substances into the lungs. And I started using nebulizing holistically about almost 25 years ago, when I, was researching, natural therapies and after I made my switch from conventional medicine to holistic medicine. And, every flu season I would see people hit with the flu. And, yearly, every flu season, from 20 to 100,000 Americans die during the flu season. We get through that. A bad flu season's 100,000 or a little bit more. And an easy flu season is like 20 to 40,000 will die. We used to get through that. We never thought about it, and we just went on with our lives. Of course, we weren't hearing about every single death as it occurred in real time, as we are these days, which certainly would have made us, more fearful and think differently. But 20 to 100,000 people dying every year from the flu across the country is a lot of people when you figure I've been practicing for nearly 30 years. When I began transitioning into holistic medicine, I heard from people they were sick with flu and flu-like illnesses. And conventionally, I wasn't taught to do anything. I mean, we were, medical school, we were taught they stay home, tell people to stay home and, rest until it's over. Well, that's okay. And that is actually good therapy. It keeps other people from getting sick and allows the body a chance to recover. But what if things get worse? What are you supposed to do? And really, in conventional medicine, there's not much to do. There's Tamiflu that they can give now, which is a miserable drug that should have never been put on the market and not very effective, and way too many side effects. In fact, the side effects are very similar to the flu. But beyond that, there's really nothing to offer people. So 25 years ago, I started researching different things, and I started looking at the old literature from the early 20th century, and doctors were having patients nebulize iodine and hydrogen peroxide. And I tried it on myself and found that it took care of my asthma symptoms when I got an asthma attack. And it was always triggered by a flu or a cold or a viral illness. And what I found was that nebulizing low dose hydrogen peroxide and iodine, the combination, has many good properties for people when they're ill and even when they're not ill. It has antiviral properties. It has antibacterial properties. It stimulates the thinning of mucus, so people can get it up easier. It also stimulates white blood cells to fight infections better. I mean, it has multiple properties. It's been used for well over 50 years in, mostly alternative circles for, treating people sick with lung problems. So when I started using it, I found great results, and there were no side effects with it. I mean, not everything helps everybody, but this certainly helped the vast majority of people. And I began adopting it every flu season, and then I began adopting it for people with COPD and lung cancer and other lung problems. And most of them experienced better breathing and better oxygenation, and I had a good therapy for people. So when the present viral illnesses started coming, and I just did the same thing I've been doing for the last 25 years. I had people nebulize a dilute solution of hydrogen peroxide and iodine, and the vast majority improved with it. It's a good therapy when the lungs are stressed and the lungs are inflamed.
Okay, very good. Well, some great advice there. And we're going to continue on in just a minute here on The Health Awakening with a whole book you've written on this type of subject. So we'll be right back with more with Dr. Brownstein right after this. And welcome back to The Health Awakening. Our guest today is Dr. David Brownstein. And Dr. David, you have written a new book, or it's new to me anyway. It's called A Holistic Approach to Viruses. Any virus that's out there, I mean, it's kind of the standard protocol, what you would do to shore up your immune system. And we want to talk about vitamins here specifically. We just talked about hydrogen peroxide and nebulizing that and how simple that can be. Let's just go through some of the vitamins that are most beneficial for the immune system. In your book, you have a whole chapter on vitamin A. Can you tell us what vitamin A does for the immune system?
Sure, Scott. Well, this book was written because I've been using the same protocol for over 25 years for treating people for viral illnesses and bacterial illnesses, and particularly during influenza flu season or influenza-like season. Yearly from fall to winter, that's when most people get sick with these things. And through research, little trial and error, I found a good protocol that works pretty darn well for shoring up the immune system. It's not a cure-all. People still get sick, but the reason you get over these viral illnesses, the reason we have society and we're not decimated from viral illnesses, is because we all have immune systems that help us to recover when we become ill. So part of this protocol is using oral vitamins, and you mentioned vitamin A. Vitamin A has virucidal and bactericidal properties to it. Vitamin A has been proven to work for measles infections and to cut measles deaths significantly, particularly in third world countries where they have low vitamin A levels. So I've used high dose vitamin A for 4 days. It's 100,000 units a day for adults for 4 days at the first sign of any viral illness. And vitamin A modulates the immune system so you don't get cytokine storm and an overreaction of the immune system. It helps the immune system fight infections better. It has some, like I said before, antiviral effects to it and antibacterial effects to it. The immune system can't work well without vitamin A. And, we have a little better vitamin A status than third world countries. But, when I check vitamin A levels in people, the vast majority are in the bottom of the reference range or even below the reference range. So people are still deficient in vitamin A. That still goes on today. Now, vitamin A is a fat-soluble vitamin, and it can be problematic if you take too much of it for too long. But 100,000 units a day for 4 days for adults, shouldn't be an issue for most people, as long as they're not taking vitamin A going up to that. And
now, is there one particular vitamin A that you recommend? I know retinol palmitate has some debate about it. Which would you recommend?
Well, people mix up vitamin A and beta carotene. Beta carotene is a precursor molecule to vitamin A. Beta carotene, to make beta carotene into vitamin A, you have to use energy or ATP molecules to do that. And it's very inefficient in the human body. It's really inefficient for people over the age of about 35 to be able to do that. So when I'm talking vitamin A, I'm talking vitamin A. There's really two major sources of vitamin A. And this is not beta carotene. Beta carotene will not have these antiviral immune stimulating effects that vitamin A has. So it's either using retinol palmitate or fish oil. Now, both work fine for the the COVID crisis that we've gotten into, primarily we relied on retinol palmitate. I do think that's a little better form for viral illnesses. But, again, this should all be done with the undertaking of a physician overseeing things. And, and then I wrote that same thing in my book. After vitamin A, high dose vitamin C. And vitamin C has its own, antioxidant as well as oxidant properties. And oxidant properties means it stimulates the immune system to kill foreign invaders. So I had people use vitamin C in the form of ascorbic acid, 1,000 milligrams every hour orally, until either they got bowel tolerance or they couldn't take it for whatever reason. And only while you're awake to do that. Now, when you're sick, usually you can take more vitamin C than when you're not sick. Your body requires more of it. And vitamin C is integral for the immune system to function optimally. I can tell you from checking vitamin C levels in thousands of patients over the years, most people are low in vitamin C. And even in today's modern world, it's because we're eating too many processed foods that have the vitamin C depleted in them. So good sources of vitamin C in regular food is, fruit and vegetables. But, most Americans don't eat enough of that. They're just eating too many processed foods. So it was vitamin A, vitamin C, vitamin D, which is another fat soluble vitamin. Vitamin D is not really a vitamin because we can manufacture that in our bodies. We manufacture that in our skin when the skin is exposed to ultraviolet radiation from the sun. And the cholesterol molecule is used as the backbone of that. And then when the ultraviolet radiation hits the skin, a reaction occurs where cholesterol is converted into vitamin D. So it was my protocol, is 50,000 units of vitamin D3 a day for 4 days. Now, vitamin D is a fat-soluble vitamin, can be problematic in high doses. Just like vitamin A, I would tell you to do it in conjunction with a knowledgeable healthcare practitioner who can help guide you and test your levels. But, again, in 4-day dosing like that, I really have not, I can't recall any problems with it. Unless somebody has an allergy to the supplement that I'm using, which I don't even recall any of that. So it was vitamin A at 100,000 units a day, vitamin C at 1,000 milligrams per hour, vitamin D3 at 50,000 units a day for 4 days, and then iodine. Iodine is really an integral part of this. And I hear other doctors talking about using vitamin A and vitamin C and vitamin D, for coronavirus and other viral illnesses, but nobody mentions iodine. And iodine is a long history of use for viral and bacterial illnesses. Unfortunately, doctors, that long history of use was in the 19th century and the early 20th century, and then it kind of faded off.
And now it's kind of relegated to if you have a thyroid condition, you need to do that. Now, let's hold that thought and let's take a break here. We'll be right back. Let's really get into iodine in our next session. We're talking about immune health with Dr. David Brownstein. We'll be right back with more from The Health Awakening. Stay with us. Welcome back to The Health Awakening. Before the break, we were just getting into iodine with Dr. David Brownstein, how it's not just for thyroid conditions, and maybe there's some confusion there, Dr. David. You said it was, used to be used a long time ago, and then we kind of got away from it. So how can we use it for immune health?
Well, doctors seem to only remember that iodine is important for making thyroid hormone, but T3 and T4 are the active and inactive forms of thyroid hormone. The 3 and 4 signify how many atoms of iodine are attached to the thyroglobulin molecule. But you can't make any hormone in the body without iodine. That includes adrenal hormones, sex hormones like estrogen and testosterone, ovarian, uterine, and anything glandular tissue, pancreas, all needs iodine to make their hormones. But it's not just the glandular tissue. It's every cell in the body needs and requires iodine. Iodine's an essential item we can't live without. And over the last 50 years, as I wrote in my iodine book, our iodine levels have fallen over 50% across the United States. Now, at the same time that's happened, we've been exposed to these chemicals called halogens, these toxic halogens, which are inhibitors of iodine. They're competitors of iodine. And the 2 major ones that we're exposed to in too large of amounts in our modern world are fluoride and bromide. So if you get too much fluoride and bromide in the body, it causes the body to bind that to iodine receptors. Instead of binding iodine, it's going to bind fluoride and bromide, and then body kicks out iodine. So that's what's happened over the last 50 years. I call it the double whammy. Our food supply has been decimated from iodine. And at the same time, we've been exposed to these toxic halides, fluoride and bromide at too high amounts. And it's worsened our iodine deficiency. So compared to our predecessors, our grandparents, our great-grandparents, we have more iodine deficiency now than they did. In my humble opinion, this is the reason we're seeing 1 in 7 women with breast cancer, 1 in 3 men with prostate cancer, and why we're seeing over 600,000 people dead from coronavirus. People don't have the basic raw materials their immune system needs. Iodine is not only necessary for hormone production, it's needed for cellular function, and it's needed for immune system function. The whole immune system needs iodine. The white blood cells need iodine to make hydrogen peroxide to fight infections. And iodine has a direct virucidal and bactericidal effects. There's no virus, no bacteria, no parasite that is known to be resistant to iodine. It's one of the reasons in surgery, they'll clean your skin with iodine before they cut into you, because they're trying to use an antiseptic to sterilize the skin so you don't get an infection when they cut through you.
So how does someone know how much iodine they need? Do they just need to work with their practitioner, or how does that work?
Well, the best is to work with an iodine literate practitioner. That's what I would suggest doing. But there's iodine testing. There's certain iodine tests you can do to see what your levels are. I can tell you, after testing over 7,000 patients between me and my partners, over 97% of people are deficient in iodine. The vast majority significantly deficient in iodine. And the only ones that aren't deficient in iodine that come to our practice have read my book. My book's titled Iodine, Why You Need It, Why You Can't Live Without It. And they're usually taking iodine coming into the practice. Everybody else is low in iodine. And so, iodine deficiency is causing all the thyroid problems, the breast problems, the pancreas problems that we're seeing, in my opinion, are a large part of the cause of that. And I think it's a large part of the cause of why people are having so much trouble with these viral infections like coronavirus. And so if people weren't taking iodine, what I told them to do if they were my patients when they got sick, was to take 25 milligrams of iodine right off the bat. Now, the RDA for iodine is 150 micrograms per day. This is 100, I'm trying to do the math in my head right now, but I think it's 100 times the dose of, over 100 times the dose of the RDA, which is inadequate in today's toxic world. But 25 milligrams of a combination of iodine and iodide, such as Lugol solution, or if they were already on iodine, which many of my patients were, and if they became ill with coronavirus, I'd have them double their dose, whatever it was, for 4 days or so. And that has a remarkable effect with helping the immune system fight infections. And I think the doctors who are promoting the zinc and the vitamin C, and it's all great and it's all necessary, but I think they're missing part of that puzzle with not using iodine.
Well, if nothing else, this whole situation will encourage everyone to start taking care of their immune system for sure.
And you know what? Take care of your immune system before you get sick.
Yes.
You want to take care of yourself before you get sick. You want to have everything in balance and taking the right supplements and eating a good diet. You don't want to be backtracking when something like coronavirus hits, because that's where trouble happens. Our maker gave us an immune system for a purpose and a reason. That's why we've survived all these viral infections over the years. And I also think if we were in better shape and our immune systems were in better shape, we wouldn't be counting over 600,000 dead in our country. We would have been in a regular flu season between 20 and 100,000 dead.
You have a chapter in your book called Other Therapies, and some folks are calling it the Brownstein protocol, that is. What is the Brownstein protocol?
Brownstein protocol is what we went through earlier, the high-dose vitamin A, C, D, and iodine for 4 days, nebulizing a dilute solution of hydrogen peroxide and iodine. And all this done at the first sign of an illness. So you get a sore throat, you get a cough, you start sneezing or fever or something like that. Jump on it early. Don't wait. The mistake we made in COVID-19 was we told people just stay at home. Don't do anything. Nothing you can do. Just stay at home till you can't breathe and then go to the ER. That's ridiculous advice. Since when in medicine are we supposed to sit back and let people get sicker and sicker when we know we know, or we hope there's therapies that can help them, and we should be utilizing those therapies. We should be trying things on people. We should be supporting their immune system. So the other part of the Brownstein protocol was using, if people needed it, we used IVs, and we've done this for 20 years outside. For coronavirus, we did it outside. For all the other flu and flu-like illnesses, we did it inside. We had sick people come in the office, hacking, coughing, sneezing. We'd go in the room. We never wore masks. We never wore PPE gear. We weren't double gloved. We would just do our business, and we'd wash our hands before we touched the patients. We'd wash our hands when we're done touching the patients, and somehow we all survived. Part of that protocol was if they got sicker or they needed extra help, we'd meet them outside and we did IVs, intravenous doses of vitamin C and hydrogen peroxide and ozone shots. And all these therapies, IV vitamin C, IV hydrogen peroxide, and ozone, they're oxidative therapies. What they do is they stimulate the immune system to pick it up, to have an increased ability to kill foreign invaders, and to help oxygenate tissue. Both hydrogen peroxide and ozone can convert into oxygen in the body.
Gotcha. Okay. Well, thank you for doing what you do. And we'll be right back with more from the Health Awakening. And we're going to teach you how to get in touch with Dr. David Brownstein. We'll be right back. Well, thank you for joining us today on the Health Awakening. Our guest has been Dr. David Brownstein. I hope you have been very encouraged by the information you've heard. I know I have. And Dr. David Brownstein, I know that when folks come to me about troubles with things that they've encountered, I always say, go and see Dr. Brownstein. So how can people go and see Dr. Brownstein?
Well, thanks, Scott. Well, I've written 16 books, and I write these books because I write about what works in my practice. So people need to educate themselves, make their own decisions on what they want to do in their healthcare. And my website is www.brownstein.com.
I love it. A doctor telling us to get educated, educate ourselves, and find out what we're doing to ourselves that we need to stop. So thank you, Dr. Brownstein. And thank you for watching The Health Awakening. We'll see you next time. Thank you for joining us today on The Health Awakening. You can catch the replay of this episode and see our complete show archive at healthawakening.tv. For more information about our guests today and all they have to offer, please visit our website on the bottom of your screen. And please remember, the information you saw today is intended for educational purposes only. It is not medical advice, nor do the views expressed reflect those of this broadcaster. Should you choose to implement this information, please do so only with the assistance of a licensed medical professional. Neither the presenter nor this broadcaster assume any responsibility for any adverse effects or consequences that may result.